ovine pulmonary adenocarcinoma. It is previously known as pulmonary adenomatosis or ovine pulmonary carcinoma, and it is popularly called as Jaxity, means chasing sickness in Africa. Etiology is Jaxity sheep retrovirus, and this virus is oncogenic and transforms the alveolar and broncholar epithelium into neoplasia. The species affected are primarily sheep, and you will also get few cases in goats. So in goats, you will find rare cases of OPA. So it is widely distributed in Europe, Africa, and America, including India. If there is outbreak, there will be 80% case fatality rate. But in subsequent years, the fatality rate will be decreasing, and it will be around 20%. The incubation period is 6 months to 3 years. If you see clinical symptoms, generally it is occurring 2 to 4 years age of animals. There will be progressive emaciation, weight loss, and respiratory compromise, particularly when animal go fast. You will find the respiratory compromise, labored breathing, and like that. These affected sheep always lag behind the flock. You will find thin mucus discharge from the nostrils, and if the head is lowered, a copious frothy exudate may pour from the nares. This is colloquially, this test is called as Wilborough test. So if you hold this animal like this, the fluid from nostrils will be there. You can collect fluid in a jar. So this is a test to identify OPA, clinical test. Then if you do postmortem examination, you will find that these lungs are very much enlarged, and lungs will do not collapse due to tumors. Then frothy fluid also you can see in the trachea and bronchi. You will find solid mass of tumors like this, and some small nodules also there, white nodules. Then on the cut surface also you will find these small nodules. Generally, metastasis is in the nearby lymph nodes, not in other organs. There is no flock test for this OPA identification because ELISA is not available. Then virus, you cannot isolate the virus. So you will diagnose the disease on the basis of clinical signs, gross lesions, histopathology, and immunohistochemistry. But recently, there is U3 gene PCR, which is giving good results. In our laboratory, we developed this assay for diagnosis of OPA, and we conducted a study on 75 lungs, and we found that 8% sheep are affected. In 8 sheep, there are 2 sheep. That sheep were of 3 to 6 months of age and did not show clinical signs or gross lesions on postmortem examination. And 4 adult sheep was severely affected, and we get characteristics lesions of OPA on gross and histopathological examination. For the diagnosis, we developed this PCR. This PCR is found very sensitive, and it can detect clinical cases and also subclinical cases of OPA.